So Scancell basically started from my academic group at the University of Nottingham, and we developed both antibodies and then subsequently vaccines. But in order to take them forward into clinical trials requires quite a lot of investment and quite a lot of money. And I've always been incredibly translational. So we set up Scancell with the idea of taking those products from the lab right through into the clinic. So the remit really is to try and get as many products into the clinic for patient benefit, and that means expanding. So we've had some very good investors in Scancell who've been very loyal over a number of years. Last year we got quite a nice sizable sum of about 48 million from current investors, but also new investors. And that's allowed us to change completely. So that's now going to allow us to build the infrastructure so that we can do more stuff ourselves. So the Nottingham labs are absolutely superb. We've just moved into the new Biodiscovery Institute in the university, which is a big purpose-built laboratory. But the development and clinical, we feel, would be better placed in Oxford.
The Oxford Science Park is obviously a hub for scientific expertise and excellence. When the opportunity came up that we could actually expand and build into laboratories as well as office space in this brand new building, we leapt at the chance.
We have good access to London, so we can bring in a lot of the business community as well.
The other benefit, of course, is that the University of Oxford and the hospitals are fairly close by, so it allows us the opportunity to network with the physicians there and bring that thinking into our designs of study.
So the build for the Oxford Science Park initially started in January-February 2021 when we signed the lease for the space. We appointed Glanfield's projects to manage the build and the planning of the labs and the office space. The challenges really for the build was really around getting equipment in, getting lab consumables in. A lot of equipment was prioritised for the COVID testing labs, which is rightly so we had to join a very long queue. But it is up and running, we're receiving clinical trial samples, so we're very happy.
So the building itself and the infrastructure is fantastic, but the building doesn't make a company, it's the people. So it's been really exciting to get a whole new team in, a whole new influx of enthusiasm and energy into Scancell.
It's tremendously exciting to have all of these new people arriving and working for the company. We've done a lot of recruitment.
Recently we're building up the translational research group, so we have new scientists that are coming in, and it's just been fantastic working with them and also working with the research groups in Nottingham.
There are 4 main areas that we're expanding here in Oxford, and those are clinical operations, translational research, development and quality.
The newest product that we're focusing on in the formulation development laboratory is the MODI2 program. This is a multi-peptide product which we would like to understand more about the formulation approach, the characterization of the formulation. Our formulation development laboratory will allow us to understand a little bit more about product, how we characterize it, and also allow us to move faster into the clinical development program.
So for the cell biology lab where the translational research group is, we have loads of equipment, so flow cytometers, ways of sorting T cells from patient samples. We also have ELISpot readers and ways of measuring cytokines in patient samples. So a huge number of instruments that you would expect to see in a modern lab.
Historically, Scancell has performed all of its manufacturing activities externally. This can be quite time-consuming, expensive and slightly inflexible. Our new formulation development laboratories will allow us to improve those timelines. We will be able to perform a lot of activities ourselves, essentially improve the timelines into clinical manufacturing.
A very exciting juncture here at Scancell. We are driven by strong science and by the sense of purpose.
We've got a fantastic opportunity now to really get our products into the clinic. We can do it bigger and we can do it faster.
We've got state-of-the-art laboratory and we've got new personnel joining the company.
Having this space means that we can bring it all in-house, we can set up development groups, we can set up the assays in-house to monitor the trial samples.
But my passion has been for a long time to try and make a difference to patients, to make their outcomes a little bit better, to get a medicine that actually works for them. And I think with this new infrastructure, these new shareholders, these deeper pockets, that all seems now possible, which is amazing, really good.